Hi, I'm Susie. I'm the carers lead for the Cardiff and Vale Health Board, and this presentation is just to give you an overview of the Young Carers in School initiative that we have put in place in partnership with our two local authorities and third sector colleagues. Just as background, and for those who may not know, the definition of a young carer is a person under 18 who's providing or intending to provide care for someone who needs support due to illness, disability, a mental health condition or a drug and alcohol addiction. In some cases, the young person is not the main carer. However, as a result of the situation, they're providing a level of emotional and practical support you would not normally expect. In the 2011 census, it was identified that within Cardiff and the Vale local Morgan, we have 1,579 young carers. However, we recognise that this is an underestimation of the numbers. Identifying carers at any age is difficult, but we find it even more so with younger people. For many, it's due to fear that they'll be taken away from their family, especially if they're looking after a parent. Within Wales, the Welsh Government has set out 4 national priorities. The first is to support a life alongside caring. So for young carers, that would mean being able to stay in school alongside their caring role. The second priority is to raise awareness and helping them to identify and recognise that they are actually in a caring role. The third priority is to provide information and advice, ensuring that they have everything that they need to support them in undertaking their role. And finally, the fourth priority is to support our carers through the hospital discharge process. So with the Welsh Government priorities in mind, we had already identified that there was a gap in services and lack of support for young carers locally. We wanted to hear from the young carers themselves, however, because we felt it was important that any initiative that we were to put in place was based on what our young carers were telling us they wanted, rather than our assumptions of what they needed. So in order to hear as many voices from our young carers as possible, we took on a number of different approaches. So the first one was an online young carers survey, and this survey was designed by young carers. The survey was anonymised so that young carers could be open and honest about the services or lack of services and support they were receiving. In addition, YMCA also undertook young carer consultation sessions. These took the form of a structured group session focusing on similar themes and questions to the survey, and looking at what young carers would like support services to look like in the future. And finally, we held a young carers celebration event, inviting young carers from across Cardiff and the Vale to join health, social care and third sector organisations. Firstly, to look at the initial findings of the online survey, but also to partake in some workshops. The ultimate goal of the event was to celebrate and thank these amazing young people. So once all the young carers' feedback was gathered, Cascade, who are the Children's Social Care Research and Development Centre in Wales, collated the responses and developed the Young Carers Speakout report. The report highlighted that in general, young carers felt there was a lack of understanding of their role by professionals, and this was across the board, but even more so in health and education. It was decided that as our young carers spent a large amount of time in education, that's where we would begin. We wanted to look at how we could help teachers and their support staff improve their understanding of young carers and increase the amount of information and resources that were around the school. In partnership with health, social services and third sector, we developed a young carers action plan, and it was really important to us that this action plan reflected what the young carers were saying they wanted. So again, with the help of YMCA, we took that action plan back to the young carers and asked for their feedback. So essentially, they had to sign off on any of the actions that we were looking to take forward. The Young Carers Speak Out report had given us a really good insight into where young carers felt that the support and services were lacking. We wanted to get a better understanding from teachers and the support staff about how they felt that they were supporting young carers and what was practical to be adopted in a school setting. Carers Trust South East Wales was commissioned to undertake a detailed report looking at what support was already in place. As you can see, the report highlighted that as with most of the settings, schools had difficulty in identifying their young carers, and this was largely due to the fact that staff didn't feel confident enough in their understanding of what a young carer was. Staff wanted more resources and information on how they could better identify and support their young carers. They were very keen and open to any initiatives that could be put in place to support them in supporting their young carers. Lastly, it highlighted that only 4 out of our 26 high schools across Cardiff and Vale actually had a young carers policy, which is fundamental to staff knowing how they can support their young carers and who to signpost to. So there was a lot of work that needed to be done with the high schools to make sure that they were in a bit better position to be able to support. We decided to ask Carers Trust South East Wales to provide their Young Carers in Schools Award in our high schools. The Young Carers in School Award was developed by Carers Trust and the Children's Society in 2015, and it consists of 3 stages: the basics, beyond the basics, and best practice. The first theme in the criteria is to understand. So here we would ask high schools to assign a member of staff who would take responsibility for understanding carers' needs and addressing them. The second theme is to inform, and that centres around awareness raising. It's just about sharing knowledge of young carers and the issues that they're facing. The third theme is to identify, so the priority there is to ensure that we are identifying carers proactively, but also allowing young carers to recognise themselves as young carers. The fourth theme is to listen. It's allowing our young carers a space and time to talk. And the last theme is support. It's ensuring that carers are supported and signposted to resources and other services. Each school that undertakes the award will be asked to provide a portfolio of evidence to a peer review panel who is made up of young carers from across Cardiff and the Vale. The panel review and discuss the evidence that the school has submitted, and they make the decision as to whether the application is successful. So young carers play a huge part in support and provision for the person that they look after. Many young carers feel there's a stigma attached to their role, and this is highlighted by 68% reporting having been bullied in school. Therefore, we feel that any initiative that put in place to identify young carers early is beneficial to their educational and future outcomes. It's felt that through raising awareness of young carers within schools, we can support them before they reach crisis, and also educate their fellow students to be more mindful of the challenges they face. So how are we doing? Since it began in 2016, the number of schools participating has increased year on year. Updates in March 2020 show that 14 of the 18 secondary schools in Cardiff and 100% of our secondary schools within the Vale of Glamorgan are now engaged in the programme. We've seen a dramatic rise in the numbers of young carers identified from baseline audit. Last financial year alone, 234 staff have taken part in the Young Carers Who We Are and How to Identify Us training provided by Carers Trust South East Wales. Working in partnership has allowed us to not only pool our resources but also our experience and expertise of how to support young carers, but in a setting that's most relevant to them. We also understand that young carers need support throughout their whole educational journey, so we are really pleased to be working with Carers Trust South East Wales to look at how we can progress this award in our local primary schools. In February this year, Carers Trust South East Wales ran an event for primary school staff across Cardiff and the Vale. Feedback from the event was really positive. 91% of the schools who participated in the event were interested in working towards the Young Carers in Schools programme. We're also pleased to say that the Health Board will be adopting the Welsh Government's Young Carers Card Scheme, with the Young Carers in Schools Award being a really great way to help us roll out the scheme. And finally, we will be continuing to work with our GPs and pharmacies to improve links with primary care and local schools. We feel that it's really important that the support and information that young carers are getting in schools doesn't just stop there.